excited to share some information and some stories with you today. So my name is Sarah Simon. I'm the chair of the RIC committee here at Good Shepherd, but I work as a speech pathologist and outpatient clinic in Madison. And one of my areas of expertise is gender-affirming voice evaluation and treatment. So I wanted to talk a little bit today about gender-affirming care, kind of as a whole, and then I'll share a little bit about what I do, and then we'll go from there. If you have any questions at any point, feel free to interrupt. That is A-okay. All right, so our outline for today, we'll go over some concepts and terms that I'll be using throughout the presentation. I'll provide an overview of gender-affirming care and what that encompasses. I'll explain a little bit more about my role as a speech pathologist and my why. I have a couple of stories to share, and then we'll wrap up with some next steps related to what you can do to support transgender people in your life. Can everybody hear me okay? Yeah. All right. So these are some terms I'll be using throughout the presentation, so I thought we'd kind of define them now. So sex assignment at birth is based on external genitalia. Gender identity refers to the internal sense of one's gender. Cisgender individuals have a gender identity that matches their sex assigned at birth. Transgender individuals have a gender identity that is different from their sex assigned at birth. A transgender woman is someone who is listed as male on their birth certificate, but whose gender identity is female. And a transgender man is someone who is listed as female on their birth certificate, but whose gender identity is male. Other people may have a gender identity that's fluid or non-binary, meaning their gender is neither male nor female, or it is a mix of male and female. And it's important to note that gender identity does not equal sexual orientation. So you will see transgender individuals who identify as straight, gay, lesbian, bisexual, etc. Any questions on these terms? Because some of them will be thrown around throughout. Okay. So let's talk a little bit about gender-affirming care to begin. So the World Health Organization defines gender-affirming care as encompassing a range of social, psychological, behavioral, and medical interventions designed to support and affirm an individual's gender identity when it conflicts with the gender they were assigned at birth. This helps them align their physical and emotional aspects of life with their true gender. These interventions fall along a continuum, from counseling to changes in social expression, to medications, to surgeries. Those who seek gender-affirming care are often experiencing gender dysphoria. Gender dysphoria is the psychological distress stemming from the incongruence between gender assignment and identity. So in short, the person is deeply unhappy that what they see in the mirror does not match or reflect who they truly are. Unfortunately, there are quite a few barriers to accessing this type of care, including stigma, discrimination, lack of trained providers, or lack of insurance or insurance coverage. Related to standards of care, WPATH, or the World Professional Association for Transgender Health, is an international nonprofit organization that promotes evidence-based care, education, research, and advocacy for transgender health. WPATH publishes the standards of care, which provide a professional consensus on the medical, surgical, and psychological management of gender dysphoria. So related to youth in particular, WPATH states before any physical interventions are considered for adolescents, extensive exploration of psychological, family, and social issues should be undertaken. So this typically starts as more of a social transition, a new name, a new haircut, new clothing. Puberty blockers, which are medications to block or pause the progression of puberty, may start between 10 to 12 years of age, based on when the youth shows signs of puberty, with counseling. Puberty can cause emotional stress if the youth starts changing into a body that is dysphoric or upsetting to them. Puberty blockers are a pause, so if treatment is suspended, puberty will resume. And throughout all of this, counseling is necessary, not to prove the youth is worthy of transitioning, but to sort out their feelings. The goal is not treatment, but to listen and build understanding, to create an environment of safety in which emotions, questions, and concerns can be explored. If the youth has mental health concerns at baseline, providers often ask for a support letter or a call from the current mental health team so that everyone knows what the youth and their family are considering. Hormone replacement therapies may start between 14 to 16 years of age. The criteria for providing hormone replacement therapies include a finding that the youth has experienced, Alice, my child, I'm so sorry. A finding that the youth has experienced several symptoms of gender dysphoria for at least 6 consecutive months, a letter of support from the youth's licensed therapist, and written concurrence from a mental health professional for the provider, parental consent, and ongoing psychotherapy. It's important to note from a parental consent standpoint that there's no evidence that families are being pushed into this type of care. Rather, they are able to determine what is best for their kids after proper evaluation and informed consent. And finally, surgery considerations take place after 18 years of age, which include letters of mental health support and quite a bit of money. Research shows that 98% of people that start gender-affirming care as adolescents continue that care as adults. Among the small number of people that do stop receiving gender-affirming care, the most common reason for doing so is not because of regret or change in gender identity, but rather because of the inability to afford continuing the care, or because of lack of social support, stigma, or fear of violence for living as a trans person. It's really, really important here to clarify that gender-affirming care is the only evidence-based treatment for gender dysphoria. It's endorsed by every major medical association in the United States, including the American Medical Association, the American Academy of Pediatrics, and the American Academy of Child and Adolescent Psychiatry. This is pretty small on this screen, but I'll run through it quick. Some key points from the most recent policy update with the American Medical Association. So the AMA, or the American Medical Association, states that treatments, as determined by shared decision-making between the patient and physician, are medically necessary. The AMA advocates to protect access to this care, opposes laws and policies that impede care, supports protections against violence and professional liability for physicians and institutions, and communicates with regulatory bodies about the importance of gender-affirming care. And the AMA advocates for equitable and evidence-based health insurance coverage as well. So we're going to move on a little bit more about my role. Any questions about kind of the physician AMA side of things? Okay. If you think of anything later, A-okay. All right, so my role as a speech pathologist, so our governing body is ASHA, the American Speech-Language Hearing Association, and they talk about the role of a speech-language pathologist in the assessment and intervention of transgender individuals is to educate and treat individuals about appropriate verbal, nonverbal, and voice characteristics that are congruent with their targeted gender identity, like postures, gestures, and facial expressions. And we will jump into what these terms mean right now. So this is a handout that I provide all of my gender-affirming voice evaluation and treatment patients. So this makes voice look pretty black and white, which it is not, but for the sake of discussion, on the left we have perceived as more masculine, on the right we have perceived as more feminine. So these are different areas of voice production that have been studied with what we call blind listener studies. So people are hearing a person's voice, but they can't see them. What are the components of their voice that they perceive as more masculine or perceive as more feminine? So resonance, and we're going to practice this together. So resonance is this concept of vibration, where our sound is coming from. So typically associated with a more masculine resonance, the deeper, kind of lower, more throaty resonance. And perceived as more feminine is a higher, brighter, more kind of in the mouth resonance. So we're going to make a hum sound together, okay? And I want you to, so I'll demonstrate it, and then I want you to tell me where you feel vibrations. So we're going to go hum. So everybody can do that, and think about where you feel that vibration coming from. They go for it. Hum. Beautiful. Where do you feel vibrations? We're down here, up in here. Yeah, there's different places, right? and we can alter that vibration. So let's try to make it really far back, kind of try to swallow the sound. Everybody kind of do that? Okay. Now we're going to take a nice good breath forward and try to get that sound up into our mouth and feel our lips tickle. Hum. You feel that difference? Yeah. So that's a very simple thing, right? But there's a lot of these tangible exercises and concepts that we talk about in order to alter resonance and pitch. These two are the primary drivers of what helps someone perceive someone's voice. So resonance is that vibration. Pitch is a little more cut and dried from lower versus higher. Intonation and inflections, these are kind of the ups and downs or the melody of speech. And then articulation, kind of how the person articulates their sounds. I will mention here that I spend most of my time working with transgender females. Transgender men typically will take testosterone, not always, but testosterone naturally thickens the vocal cords, like anatomically. So a lot of times transgender men don't seek out voice therapy because their voice naturally deepens. That is not always the case, but more often than not. So let's talk a little bit about how I got into this space. So in September of 2013, my first client in graduate school was a transgender woman named Lauren. I'll share more about her in a little bit when I share some stories, but she had wanted to transition for decades. In 2010, she decided to become her authentic and genuine self, and she wanted her voice to reflect that. She really inspired me. My current practice now includes gender-affirming voice evaluation and treatment to help people achieve their authentic and genuine voice, reflective of who they truly are. All right, I have a couple of fun stories to share. I met with these two individuals separately to talk about their transition and their experience, and they were happy to have me share that with you all today. So this is Kristen. Some of you may recognize Kristen. She's a member of Good Shepherd. She typically attends at the Verona campus. I sat down with Kristen and I talked to her about her transition and some information she felt would be appropriate to share. So she told me that her transformation began in May of 2023 at the age of 44. She said, "I am not too old to become the female version of myself. I am too young to spend the rest of my life wondering what it would be like to be her." Kristen laid out her transition in different parts. She told me about her social transition first. So she told people closest to her spouse, her pastor, certain family members, and close friends. Then she began working on her gender presentation. She shaved her beard, took a makeup class, bought women's clothing, and ordered body shapers and a wig. Then she embarked on her medical transition. She goes to UW. She saw a UW Health Gender Services Clinic provider and was assigned a health navigator, which is a nurse well-versed in gender-affirming care who walked her through all of her available options. Her first priority was hormone replacement therapy, which she began after blood work and a consultation with an endocrinologist. And then she talked a little bit about the legal transition. She applied for a court-ordered name change, a new social security card, a new driver's license, the list goes on, a new birth certificate, a new passport. She had to change her name and gender markers with everyone. But she concluded this kind of piece of our interview together by saying, "There is nothing more exhilarating than being my true self, loudly, proudly, and without apology." I asked Kristen, I said, "Why do you think gender-affirming care is important?" And she approached gender-affirming care from more of an ethical standpoint. She said, "The most basic and fundamental answer to that is that bodily autonomy for everyone is important. Everyone has a right to do with their own body what feels right to them and what allows them to live in that body with dignity, with a sense of peace, and with a sense of comfort in who they truly are. Gender-affirming care for cis and trans people is part of respecting that autonomy." She also went on to talk a little bit about how the most abundant consumers of gender-affirming healthcare in the United States are cisgender people. If we think about hair transplants or Viagra or laser hair removal, weight loss treatments, and breast augmentation, all of those things are gender-affirming care, where we say, my body does not match what I want to see when I look in the mirror. As I mentioned before, Warren, my first client in graduate school, began her transition in 2010 at the age of 60. She said, at age 4, I knew something was wrong, but I did not understand it. I also knew never to speak about it. I held that secret for a long time. She said, I know I started my transition when I was 60, but I got to be me. And that is such an incredible thing that I never thought would happen. A little backstory about Warren. In 1990, after being married for 13 years, she has a wife and 2 children. An unethical therapist actually outed her to her wife, which resulted in marital turmoil. Warren decided to stuff her feelings again for almost 20 more years. She fell into clinical depression. She found a new and trustworthy and supportive therapist in 2010. She told her wife, I have to transition. Her wife fought her on it, and Warren attempted suicide. So when I asked Warren why gender-affirming care was important, she approached it from more of an emotional standpoint. She said, gender-affirming care is critical. Transitioning is urgent, a life and death decision, a survival decision. Her wife realized how dire her situation was and has since supported her throughout her gender-affirming journey. A study published in the American Journal of Psychiatry found that compared to the general population, transgender individuals were 6 times more likely to have a mood disorder, 3 times more likely to have received prescriptions for antidepressants or anti-anxiety medications, and 6 times more likely to have been hospitalized after a suicide attempt. Warren shared within 3 days after starting HRT, she had a peace she never had before. I think another really interesting piece of my discussion with Warren was her perspective regarding her relationship with God throughout her life. So during her childhood and adulthood, she said, I prayed every day for God to take this away from me, to relieve me of this. I felt like God was punishing me, like God wanted me to be unhappy, confused, and miserable. After her suicide attempt, she said, I reconciled my belief about God. God made me this way. There must be a reason. Maybe I have some purpose here. And now, Warren feels that she is here to take care of other people, to be here for them. If they are afraid, I will go with them. And what she means by that is she now mentors other individuals who are thinking of beginning or who have begun their transition. She meets them for coffee or lunch. She takes them shopping for makeup and clothes. She supports them in whatever ways they need. And I think that's a really important piece to take away from this. It's my goal and my job to walk hand in hand with my patients non-judgmentally, just as Jesus walks with all of us. So let's conclude with some ways that you can support transgender people in your life. I think first and foremost, it's important to say you don't have to understand someone's identity to respect it. I asked Warren and Kristen about some ways that they would appreciate if people would understand and support them. And I think it's important to note, there's no one right way to be transgender. A transgender individual's identity does not depend on what things they have or haven't done to transition. No 2 transgender individuals' journeys are exactly alike, just like Kristen and Warren. Warren said it takes an enormous amount of courage to transition. Kristen said, give people the grace to change. Do not try to keep people trapped in the version of themselves that you are familiar with because it's what makes you feel comfortable. We are all in the process of constantly evolving. Finding the version of yourself that feels the most natural, that feels the most at home, is a process. This is true of everyone. Finding the version of yourself that you love most is something we all go through many phases of throughout our lives. I'll leave you with this. Think about the affirming part of gender-affirming care. Trans people want to be themselves, just like cis people do. Any questions? And thank you for your attention. I know it's a big topic, but any questions or comments from here?
Oh, I just have so and somebody, we have a trans daughter.
Okay.
She's 30. She's doing well. But I just wondered about the logistics of coming to you. Did I have to go to a doctor to be referred, or can I come directly to speech?
Well, sure.
How does insurance pay more?
So it'll depend on the health insurance providers. So I work at one of the SSN Dean Medical Group outpatient clinics. For our system, you do not need a referral from your primary care physician or a different. That's where most of our patients come from, is through a referral, but you don't need one. Can certainly come straight to us. And as long as you have insurance that's covered by where we are, we can do that. I don't know the process that you do. I mean, I know they have a team that does Gender-Affirming.
She's out in Reno. She's kind of fun. I just wonder for me. She probably knows all that.
Yeah, and it just kind of depends on the insurance provider. Like I said, at SSM, we are not a referral-based specialty, so people...
So are you saying it's actually possibly a change the pitch of your voice?
It is. Yeah. Yep. So there's a lot of work that goes into it, but I kind of present to my patients, my role is really to help you with the physical standpoint, but then there's kind of that emotional piece, right? Does this feel reflective of me? Does this sound good and feel good to me? And that's obviously a very person-dependent situation, but it is possible in terms of I don't know how in-depth to go. So our voice box, or our larynx, which is the structure gear, if we hold it and move it in a certain way, we can modify the pitch of our voice. So it's really about learning what physically the person can do and feels comfortable doing, and then building upon that with, we start with words, sentences, paragraphs, like building that hierarchy of being able to maintain that position. Does that make sense? Yeah.
Just to add,
Yeah.
Planned Parenthood does take better care.
Oh, good. Good to know.
That's where I go.
Thank you.
Yeah. Yeah. What percentage of your patient population would you say is gender, is for this topic? And then not all speech clinics would do this telecare, correct?
Correct. Yeah, that's can't just assume. You can't just assume. Yeah, so when I started at SSN in 2016, we didn't have a provider that was doing gender-affirming voice. With my background more in, I did graduate school. I, dove into continuing ed coursework, stuff like that, and became knowledgeable, and then just kind of built it from there. And not a huge percent of my Haitian population, maybe 10. But I think I would say that's now. There was a huge surge during COVID where I saw a lot of transgender individuals, quite a few. I think, too, now that telehealth is being kind of phased away from an insurance coverage standpoint, I don't know how that will impact some of the patients that I currently see. I think telehealth has been incredibly helpful for certain patients within this population. Just lack of transportation or just anxiety about having to go to the doctor, right? Being able to do that from the comfort of your home is a very different thing. So, yeah.
I think in the movie Will and Harper.
Oh, yeah.
That Harper was talking about, I think as I remember this, she wanted to change her voice and then said, yeah, forget it. I'm just going to stay with,
And I think that's part of the reason right? Like, as the medical provider, the physicians that I work with that do, the hormone therapies and things like that, I mean, their transgender population is huge, right? It's a huge portion of their caseload. But not everybody chooses to change their voice or wants to, and again, that kind of goes back to it's that person's decision, and that's okay. Yeah.
The voice does tend to be the first number one giveaway.
Yep.
Sadly.
For sure.
People don't care how you look on the inside. As soon as they hear their voice, that's where the judgment comes. Yeah. I treat out numerous people for that. Yeah, wow. I will look them dead in the face. I go, do I look like I'm dressed like a boy?
It's fair point. It's a totally fair point. Yeah. I think a lot of times too, some of the recurring goals that a lot of my transgender patients have are to not be called sir, typically, to not be called sir on the phone or in a drive-through, right? Kind of especially those situations where he can't see you.
It's a big one.
Yeah, for sure. And that was actually Lauren, the person's story who I shared. One of her goals was to not be called sir at the McDonald's drive-through. And she wasn't. When we were done working together, she came in on her last day and she's like, so I went to McDonald's last night. So it was the day before our last session. And they called me nothing, which is perfect. right? And so he too.
It's better than sir.
Exactly. Yeah.
Just a wide comment. When you started out and talked about the voice and everything like that, I wondered if you were recruiting for the choir.
Certainly not. No, I am not a singer. Oh, do not attempt that.
But the question that I did want to ask was, in getting a new Social Security card, does all of your former assets in Social Security or identity transfer to the new one? And that's it. What happens to the old number?
I don't know the answer. And it has to be by state, because Georgia, you have to have the sex change, the surgery to be able to do it.
That is true. There's different protocols. I say that. But is that the answer?
Yeah, as far as I understand, if you go that route, your social security number would stay the same, and I believe your former name would be listed as a alias.
I think that it's So your number would stay the same. Your name would be updated. But if you ever pour something out, it's like, were you known by any other name?
Right now, our preferred names are the aliases. Yeah, and it would just swap. But there's usually requirements for like changing gender marker, changing names, that you publish it in like a readily available like newspapers, right? That's so that you're not like running away from any dead sirs, Ziegel, some or say a hiccup for it.
Yeah, I know. Kristen had a big focus on that. That was a long piece of the transition.
It can also have a negative impact on your credit score for some reason, but if they think you're dodging this, you're being nefarious. That's because, why else did you want to name Jay? You were dodging the IRS, but what was last reason?
Yeah, be correct. Yeah, correct.
They had nothing to do.
Just right.
True boards. I have randos are to move by.
Okay.
And I'm never quite sure which way she's leaning at the moment. You ask ours for pronouns. And I'm wondering, can you give me a little insight into what's going on in her mind at that,
I just see go back and forth between he and she, depending on how they dress.
Well, he, she dresses sort of out of a sea order top.
Okay. Well, so when I started for the first year, if I dressed more like a boy, I used my given name. If I dressed more like a girl, I used my female name. That's what gender fluid is, where it's how you feel in that moment, and that's how I started. So if they're leaning more towards gender fluid, it just depends. It's a daily thing. It can always change.
With my granddaughter, it seems that's more who she's interested in the more.
Beatrice, how she identifies.
And for the last 3 years, she's been interested in a God.
Okay.
And so, at this point, she's a she.
Sure.
But I know that could change over time, so it's...
Well, and so maybe like you said, right, kind of how you're feeling, but maybe in her case, it's more how old is she?
She is going to be 21.
Okay, so kind of
Like a social.
yeah, right, more of like the social piece of it. External social piece of it, not necessarily,
It's also kind of, it's different for every kind of person, how they identify, like for people who are bisexual, whether or not that includes people who are non-binary or transgendered. It depends person to person. It's not like a universal standard.
And we're really lucky that our daughter, Lynn, is very forgiving. If we're trying, it's fine. She'll, just go.
Everyone says that as long as you try. I've met high schoolers that say that. It's like, as long as you catch yourself, you apologize and correct, no one cares.
Yep. And I think that's totally fair. That's the feedback I've received and heard. And
Yeah, I bet you will be like, oh my God, I'm so sorry. And it's like, hey, you correct it.
Yeah.
You apologize. It's like, go forward. Okay. It's like my son, all his friends are part of the queer community. He's in high school. Every single one of his friends. And if he hears you misgender someone, he won't even look at you. He'll just go, smart book, that my kind of thing he can do. He just corrects you and he stops right there. So I learned a lot from him and his friends. So
yeah. No, I think that's it. And I think that's a good takeaway for everybody, right? Is just tried. And if you're unsure, just ask. I mean, to me, that feels better to me as a provider to patients, right? I always start and just clarify pronouns, right? Because I'm writing the reports, I'm talking to the person, I sending this on to other people sometimes, so it's important for that to reflect the person. Yeah.
On that note, I've met others and myself included. When you ask someone you're unsure their pronouns, and you notice I do this, they tend to get the biggest smile because they're more flattered you took the time.
Yeah, definitely.
So I've met like non-binaries and trans people where it's like, well, just to be sure, what are your pronouns? And every time they're like, oh yeah, they're always happy to talk about it. I mean, the first time I was asked, it kind of threw me off because I never been asked that. It's like, I don't know how to say that.
Yeah.
So it was weird, but now it's like, it's what you prefer. Someone has enough. It's the word I want.
Yeah, I respect.
Well, yes, but it's not the word, but close enough. That enough respect to think about it. Fairness. Always ask, because I've met like workers before, and there was a girl like in Florida, or like they're non-binary. So there was a person in Florida, and I wasn't quite sure. They had really short hair, t-shirts, jeans, but that doesn't mean anything. And I was like, just out of curiosity, what are your pronouns? And they got the biggest smile because they were so tickled that I forgot that.
Well, you didn't just assume. Or, like, avoid it completely, where it's because we're upwards.
So when they said them, I was like, non-binary, and they're like, oh, yeah. And I was like, but now I found out that a couple of years when they still lived in Georgia, they were on T, so that it being Florida kind of changed, so they went back to a whole non-binary.
Gotcha.
But, yeah. That was the issue I had in Florida, was trying to find any form of gender-affirming care. It was not easy. Yeah.
Right. So I will say another way to just be helpful.
Yep.
So, I mean, like, there is an extent where you can be a little too enthusiastic. When me and Charlotte first started attending, there were a couple of people who would go up to us and say something to the effect of like, "We are so glad that you're here. It's a part of the welcoming committee, blah, blah, blah. We push towards this." And it's like, we feel out. You just kind of just want to like be ice somewhere. Be still.
I think that's a fair answer.
Yeah, it's I mean, it's not the worst thing in the world to have. It's definitely better than the opposite, but sometimes it could be a lot.
You just wanted to treat like everybody else. And then over time, that definitely happened here too. Sure. Like you felt less novelty. Sure. You feel very accepted. Guy.
And I think we've talked about that from an RIC standpoint, is how do we welcome people without having that novelty, right? And it can be a hard thing. And I think hearing, I'm glad that you felt welcomed, right? But certainly not like spotlights on you, because,
your guy team kind of felt like that. Because the day I fell off. It was coincidence.
Yeah, still out. Yeah, maybe not the best.
No, not with all the prize everywhere.
Yeah, it's sort of the younger people. It's just all normal. But you remember, for us older people, it is quite different. I'm having to learn quite a bit. Yeah, read a lot and stuff. So no, we're trying.
That's all they can do. Yeah, I mean, it's like, and that's the best you can do, right?
It's kind of a reality that in a lot of spaces, like church spaces that tend to skew a lot older, I kind of enter a place and you kind of have to assume I'm the first transgender people, the majority of people here that are at. So there is just confusion and introductions to make that you just kind of have to accept.
And I'm excited to be able to question to ask. I'm a little proof. She got a voice that conversation says, "Oh, go cut." Look, good. Charlie don't care. She'll tell you whatever you want to know. She's not embarrassed.
Well, that's okay too. Is there any other questions or comments or things you're wondering about? How often,
Like, how long does voice therapy usually go on in general?
Yeah. I would say, so typically I'll see someone for their evaluation and we'll schedule 6 sessions. Sometimes people do weekly, sometimes people do every other week. It kind of depends on their schedule and life, and that's okay. I would say anywhere from 6 to 12 sessions is typically a normal course of it. I think it really depends on the person's goals too, right? And certainly, there's an anatomical piece of this where the vocal cords are different in every person. So I think sometimes there's, especially at the beginning, this process of kind of setting expectations, like realistic expectations for what the person can physically accomplish in a healthy way, right? We don't want someone to be producing a voice that is strained or unnatural because that's not going to feel and sound good to them. So, sometimes the first 2 sessions you're kind of figuring out like what's the level we can obtain together. So yeah, 6 to 12 sessions over the course of either weekly or roughly every other week sort of therapy. And then I kind of space it out as the person gets more comfortable. And then eventually they go on. I just hear from them. Yeah. Yeah.
It's a matter of genetics and luck too. Like at a certain look, my voice is very naturally low, so I lighten it. I try and work with resonance, but at the end of the day, I know what my pitch is. I tried to push it higher. I sound like Mickey Mouse. And so at a certain point, I'm like, you know what? I'm just going to join choir be a day, so I don't care.
Right, and that's okay. That's totally fine. I think,
But Lynn, ours is she's based.
yeah, right. I've used she's through the mobile.
She says a little bit. Almost do baritone now.
An example of that too, early 90s where I worked, there was a guy who was transitioning.
Okay.
And everybody at the company had to go to, the sessions of the HR director who was crusty old white guy, a smoker. It was really interesting. But when Tim was transitioning, he changed his voicemail. And, he tried to become a woman on his voice, and it was just a company joke, It's like, just be yourself, It's like, it was, my staff, who were all women at the time, would call up and, try to find these messages. It was just kind of, that's pretty sad.
Yeah, that is. Yeah. So I think there is a lot of that kind of working together to figure out what we can kind of physically achieve, but also what feels and sounds natural. I mean, even Astrid, your comment of like you feeling like you sound like Mickey Mouse, right? I think if a person feels that way, they're not often going to try to talk in the voice that makes them feel that way, right? So I think trying to find this balance of like, this physically feels good, this emotionally feels good, I can produce this voice feeling confident. Because if you're not confident about the voice, anybody, right, our voice is not going to sound the way that it normally would. So, any other questions? Okay. My email is listed, I think, on the website as the RIC chair, but also in this, or I can just give it. If anyone has any questions, you're welcome to email me, is what I'm getting at. Yeah, thank you all for your attention and your attendance. I'm glad to share it with you today. Thank you.